Hello everyone. So here's my Pure Spin box that I said it's a kit. It's a sterile kit. So we are going to open the kit, okay? And this comes with all my tourniquet and the medication that I need to keep it, you know, anticoagulated. So here's, we open these, okay? And we have all our stuff we need to have. Gina, can you take some strip off of it? And then I'm going to get it ready. So I take my 30 ml syringe. I make it flow a little bit. And I have a needle. I'm going to draw just 2 ml of my anticoagulant. This is my sheet that I have. It's a sterile sheet, so this is why I like this kit, because we do everything sterile. Gina, will you please calm the tourniquet on it? So I just want this one. Like this in her hand. This is just for stabilizing our needle.
You know what, this one, I have a better way than this one.
You do? Then let's just move it to that side then.
Right here.
You know.
Yeah, I know.
So here's my 2 ml of my anticoagulant I'm going to just draw, okay? And then I'm going to attach it to my butterfly and draw my blood.
Yeah.
A towel or something that you put your arm maybe? Oh, there you go, that way. So,
Yeah, like that.
are we ready with that?
Is it tight or not? If you need it tighter.
I can make it tighter, I'm coming. Okay.
Do I use this pillow for under your arm for just the temporary?
No,
It'll come off.
I'm gonna use my.
I can have the little chair, Gina. Is your this arm better? Oh, sorry. Okay, just put it like this. Okay, good job. So Gina, I would like you to come to other side. No, yeah, just a do you have your glove on? Can you have your gloves on? Okay. Put your head like that, resting.
You want me here or over there?
I want you here, Gina. What you're going to do, Gina, is needle. If we need to, just put your finger on the needle so the needle stays in the. Just relax your head back.
I'm gonna I'm like, oh. I always watch.
I know you
watch.
did.
Yeah, I don't know why.
Okay. All right.
See, I always look away.
I know, I don't
That's
watch.
me. I don't
Gina,
want to
hold
see
this. If I
just
need to,
want.
put that on my needle. Okay. Because I'm going
Hold
to.
it in place.
That's it. All right.
It's nice to use a butterfly needle. Because it's
Yes,
very
we
thin.
do use. The only thing, one more thing I need to get is, that's okay, I'll get it. Okay. All right, here, my dear. Keep your hand down and, no, yeah, that's fine. Just a little tiny bit, like this. No, that's fine, yeah. Good. And keep your fist, my dear, and keep your fist. Open and close your fist a few times. Good job. And keep it, okay? Zina, put a finger on my. That's good, girl. That's fine.
Yeah, no, it doesn't hurt at all.
Take the figure out, Gina. Just, yeah. Because if we push too much, then, but be ready to just support the butterfly area.
Okay.
The plastic area. Need to. Okay, can you support the, no, towards me? Yeah, where my thumb is, where you support, no? Just down there. Good job. You doing okay, my dear?
No, I'm doing fine.
Great.
blood draws don't hurt.
Yeah, she
Yeah.
just is excited about the yellow gold. That's good. Oh, it is fun. Support again, Gina. Okay. You're doing well, my dear. Almost done. Okay, just let go. Hold the 4x4. Okay, sorry. It's okay. That's fine, that's fine. Okay. I'll take that from here. It's okay. Do you let me go? I need it. Okay, so that part is over.
It's a little dark. You need a little water.
All right, you can come this way, Gina. Okay, let me just do this. All right, now I'm going to just move this.
It's gonna be cake compared to
I am going
tattoos,
to.
huh?
Oh yeah. Do we want to put a little
Gina?
hat on
Or just put a band-aid, please. There is a band-aid in here. You can put some pressure and band-aid. Now, so Abhi, you can see, I'm going to transfer this, okay, to my first spinning bottle, okay. All right, here we go. So the reason I like these kits, and this is why, because these are very well manufactured.
the band-aid, but
We're gonna do that so you can look nice and pretty. Give me a smile.
What we are going to do is we are going to counterbalance this, okay, so that when we put it in the spinning machine, then it's equal. See that? Okay.
What is in the other?
The water. It's just water. Yeah. It's water to spin. Okay, here we come here. Abhi, you want to come this way? Okay. So now we are going to put this in and counterbalance with this. Okay? We put this.
Let's take a look at it one more time.
Okay, here we are. Okay. So we have our balances. All right. And we close. And this time, first spin is for 1 minute. Okay. So we'll dial the clock down to 1 minute. Okay, this is 4.2. And we switch it on. How are we doing here, Katie? All right, Katie, I'm excited. The first part of spinning is happening. And then we will start. Gina, can you please wipe her face off the numbing cream, and then just gently on both sides and dry with this. Yes. Okay. So first spin is for 1 minute. It separates it to some extent. The second spin is going to be 4 minutes. That really, gets out the gold thing. Okay. All right.
oh, I'm so sorry.
Oh,
are you okay?
I wiped over her. I'm sorry. Here.
Burns just a little bit. I'm sorry. That's okay.
Okay. Are you okay? Did you put too much?
No, it's
I just went over her.
I've got in my eye.
Oh, you did?
Yeah, I'm sorry.
Oh my. Okay. Just dry it. Yeah. Dry it. Yeah. Okay. So the spinning will start when it gets to 4.2
It's happened before, believe it or not.
It started now, so that's good.
I think I had too much on the thing.
You okay then? Are you warm?
I'm always
What kind of
it's my natural
what
state.
kind of BLT? I don't know.
Numbing cream, we use BLT.
Oh.
Yeah. So it's 20%.
20%.
Yeah, so it's really strong.
Can you use that numbing cream in other places?
Yes, everywhere. But only with the MD prescription though. I think you can't use if you don't have an MD because it's very strong.
Okay.
In excess amount, it can cause heart activity. But my girls are trained how to use a very small amount.
Like for Brazilian waxes, you would be able to use it, or
Brazilian waxing, you could use it, but I don't think that they are allowed because I don't think there is any, there is no RNs and MDs.
No, it's fine.
And you can use it. It's a by prescription. It's a prescription cream. Okay. Compounded with a doctor's office. So at Brazilians, if you don't have MD and only aesthetician, I don't know. Because one thing is, remember, if the sensations are down and if they're putting too hot or wax, burn can happen. The good part of the numbing cream is it numbs it when we want it, but the bad part is if you numb too much and patient doesn't feel it, then you don't get the feedback. So we got to be careful. So same thing for any kind of hair removing, really. We prefer patients to know it hurts. Whereas for this procedure, of course we will be making some channels and it's painful, a little bit, so that's why we have numbed it nicely. Okay? Alright, so the 1 minute numbing has happened. And what we're now going to do is to transfer it to another one, my second bottle, okay? And then that will take care of further separating, okay? Actually, I could use my blue sheet here. Just let's not touch this. I just want to keep this here. Okay, it will open automatically. And as soon as our second needle is ready, I'll start microneedling. So see, the machine is so good.
Is it on? Is it on? Okay.
The machine is so good. It will open itself, and it's a very contained, very secure system. And you'll see the platelet. There is platelets, poor plasma, and the rich plasma. It's amazing. It's just amazing. In fact, when the second needling, the second spinning is happening, I'm going to start microneedling.
Look at that.
Yeah, and then we will get that.
So how long is the spin process?
First spin is 1 minute. Second spin is 4 minutes. See, it automatically comes out, and this is our control, and that's our golden liquid. First set, right? I'm going to now remove it and put it into another liquid form, and then we will respin it, and that's even better. This is the first spin, and that is the second spin. Okay, I'm going to discard a tiny bit of this red liquid, just a tiny that's there, and then I'm just discarding a tiny bit of redness before I get them all. Okay. So now we actually use our second syringe, which is
that actually can do that.
here. Okay, and we will transfer this into the second bottle, and I will be leaving the red blood cells behind. It's very beautiful. A little bit of, it's coming, but
You want me to hold something, Doctor?
no. Because we will be spinning one more time, very minute red cells will be spinning again.
You're extracting blood cells right now.
The platelets.
Oh, the platelets.
Plasma.
The plasma.
We are extracting the plasma. It will still be a little tingy,
Okay.
but the second spin,
Okay.
we will get better even. That's why we do the second spin.
Oh, okay. So that's the liquid gold in there.
That's the liquid gold. You will see it will come. It
That's
comes,
the
it
plasma.
comes amazing. But we have to have the airtight systems in order to spin them. Okay. And then second spin is while we get ready for microneedling. Alright. We always counterbalance them with our second one, and that seems perfect because that is the average patient. So now we are doing second spin, and then this one is for 4 minutes, during which we are going to start our microneedling. We dial to 4. Here we go, and we go. Now, Katie,
Yes.
exciting. All right. All right. My Katie is excited. Okay, Katie. Little painful, but here comes the vampire. Alright. And Katie has had one microneedling, and at that time we did it with vitamin C serum, but this time Katie is having it done with the PRP back here. That's better. Sorry. Okay. You are a tall girl. You can up. Okay. So you're feeling comfortable?
Yeah.
All right, my dear. Okay. So this part. We have covered this because when we start putting our PRP on her face, it's going to leak a little. It's very, like, it is supposed to be liquid. I'm going to change the gloves once I start putting the PRP on her, just to stay sterile. It's not necessary. One can use other stuff, other things, but I feel like with my fingers, I will be able to provide better penetration, but with the sterile gloves. Now here's my micro pen, okay? Before we get our PRP, this is a peptide gel which I will be using. I start with her face, a cheek, okay? It's coming. Okay. This gel I'm using in the beginning in order to start the microneedling process. We will be doing the cheek, the middle of the face, and forehead at the end. Okay, now comes, I'm going to have my pad. Okay, so it is at 5. Now I'm going to put my dial. It is at 0.8. I'm going to change it to 0.8 is good. I'll start with 0.8, and then we may have to go up to 0.1. I mean 2.1.
So are you increasing the surface area of the micro incisions that you're making? Is that correct?
Deeper.
Deeper,
Depth.
okay.
Okay, I'm going to try and see over. We are going to adjust it accordingly. All right. How does it feel?
Don't feel really bad.
Feel it?
Barely.
Barely feel it?
Yeah, barely.
But feel it.
Not really. I didn't really feel anything. Feel really numb.
Numb. Okay, numb. Numb is good. I will increase the depth a tiny bit now and the strength, but I'm going to not go beyond 1 because, you know, she is young. She can do 1, but I don't want to do anything more than that, okay? All right, here we come again. But you can see a little redness is developing, okay? How does this?
That's fine.
She is nicely numb, okay? But you see the redness developing? And soon there will be some blood spots. I don't want to make too much, but we need to make enough to get our serum in. She's ticklish.
It tickles a little bit. Like under the jaw.
We did good with numbing. I'm doing my first set of thing, and then I'm going to bring my PRP and do the second set.
Tickles right there.
You can see small petite forming. There are several ways of doing it. Some people would do like this, straight on. Which one is better?
Tickles, sorry.
I think I like the round ones because I feel like I'm making more channels. This is a little bit dry right now because I'm going to get my PRP as soon as my machine is starting, and then I'm going to start pouring that. You can do your vitamin C serum, but we'll grab our PRP in a moment. I think she can feel it.
That one, yeah. Not too bad though.
The channels of these skin are open for up to 5 minutes, and that's where our machine will be starting. See this? Nice. I'm using 1 millimeter. good thing about this is we can go very close. Sensitive, I'm sorry.
Yeah, that one sucks, but
Okay. I'm going to stop this for a moment. See how our spinning is coming along. Okay, all right. Doing okay?
No, yeah.
So our spin is done. As soon as the thing comes, the top opens, Gina, we're going to have that ready. So Gina, you could wear one of these gloves and just put it on the
No,
side
it tickles.
on your right hand, because you will be helping me put it into the skin. Okay, come on to that side. Okay, so let's go get the golden liquid here. Liquid gold.
Liquid gold.
Liquid gold. So 0.8 seconds.
Yeah.
We will be
From
coming back, and
before.
I don't want them to close, so I'm going to drop this to that. Okay, I'm coming right back with your good stuff, my dear. And then Gina will help me to put these in. Okay, so let me get the good gold, and because the plan is to be able to put it as we go. That's the plan. So 0.4 seconds, and it's going to open. And we will be ready with 2 syringes here. The smaller syringes. And one more syringe. Sorry. Okay. We can at this point inject it or put it topically. In her case, we are putting it topically. But when we do our injections, I get it in the needle with the syringe in the needle and inject under the skin. Yes. And scars, we can revise scars. We can do breast lift. If someone is really sagging, we can actually inject this in the breast cleavage area. It makes it look so nice. Okay, this is ta-da! See that?
That's the goal.
So that is it. Okay, Katie, here we come. All right, Katie's all excited. Okay, so I'm going to give some to Gina, and I will have some. So this is all liquid gold. The bottom one, very bottom one, is actually even better. The top one has less growth factors. The bottom is the best. When we do our injections, we will be actually taking the top off in one syringe and the bottom into another syringe, because the bottom is even more precious, and we start with the bottom syringe. Okay, so this is what, Gina, you will hold. Okay, my dear, hold very carefully, and I will tell you when to apply it. And the very best part is this one. So if I was doing a facial, I would actually be taking this one out. Okay, and this one we just resuspended, and because the bottom is all good. This is very, very precious. And this we can actually inject it in the knee also, and that will really help grow cartilage.
So I have one quick question. Because I have a little inverted V here.
Yeah.
So
we should do that.
So I was wondering, could you just inject it without the machine? Just inject it only?
Yeah.
Okay.
We can do that without the machine.
Okay.
So that's where the facial and scar injections come. This is your blood. Wherever you want, I can inject it.
Okay.
Yeah. Okay. Now we are going to have this. Okay. Now, Gina. Okay, you can drop it here, Gina, as I do this, and then we will just 1 second. You have. Oh, let me have my sterile. I want this sterile gloves on. So that's okay. I can do it. And this. Sorry about that. Okay. Now we can actually rub it into her system much better, and then finish the process.
We should all be getting one of those.
I know.
How old are you, Gina?
Oh, I'm sorry.
I'm all.
Oh, I'm 24.
24.
Left hand is harder than right hand.
You don't know how old I am.
Did we do the live audio?
Have you
go
done
right
one
now?
of
Yeah, you've been live this entire time.
Oh, you were?
Yeah.
Okay, good.
Katie
Like-
did it
So if you just want to say hi to everyone.
Hi everyone. Thank you for watching. I'm so excited to be doing this facial, vampire facial live. And let's go. This is the fun part. Okay, Gina, you can pour some here, and then okay. All right, here we go. Now we are on. Okay. Okay. Here, put it on. Put it drop. And just rub it. Okay. Yeah, just one. Yeah, just rub it, Gina. And then that's it. Small amounts. Good. it all to go in. And then Gina, pick up the red smaller one because we'll use that one first. Yeah, drop that in. Good. Okay. That's good. No, that's fine. Okay, we'll go to the other side of her face and then we will do this. Now we are doing the vampire facial part in which we actually are putting, okay, now you can drop there. That's good. Nice, very nice. Okay, turn this way, Katie. Drop another one, please.
This is precious.
Drop some more. Yeah, drop some more towards me. Yeah. Okay, turn this way, Katie. Wait. It's okay.
This is the most important part.
Yeah. Yeah, put some more, Gina. Here on my where I'm doing. Yeah, good job. That's it. Am I doing okay, Katie?
No, it's fine.
Good job. Okay, let's go up, Gina. Put it up here. Go ahead. Put some more, Gina. Yeah, keep dropping as I go forward. That's good. No, that's fine. Keep your eye closed, my dear. Keep your eye closed. That's fine. No, let me just finish this. It's her blood, so she's drinking it.
Truly vampire.
Yeah, right. Yeah, coming along nice, Katie. The best part is our Katie loves these things.
I do.
Yeah. Okay, I'm coming close to your eyes, so keep your eye closed, my dear. Okay, Katie, can you have some more? I'm just going to rub it in. Yeah, put it on. That's good. Good job. Katie, do you want me to do the top lip, my dear?
If you want, it
Okay,
sucks,
why don't it sucks? I know. So let's go through this area here. Okay. Drop one. Just Okay, drop it. Drop that. Accurate. I'm going to be very quick.
That one hurt? Center one.
Okay, all done. You're doing so very area.
I know that from a child.
Okay, you did well. Okay, you did well. I'm just going to finish it here before I go to your forehead, okay? Okay, Gina, put some more on this side. Yeah. That's a good job, huh? Okay.
I remember the forehead kind of sucks too.
I know, that's why I'm going to come to it towards the end. I think we've covered your skin pretty well. Alright. Just a little bit on your nose, my dear.
Oh, the nose sucks too.
Yeah, just give me some.
Any bony parts.
Okay, that's a good idea. Okay, so just, sorry, you'll be over there a little bit, but we are coming out here. Might as well make your nose look good, huh? Sorry.
You're fine.
Good girl. You're doing well. Nice. Okay, on this side, Gina, a little bit. Keep your eye closed. Nice. Okay. Almost done. So we have kept our needle depth to 1 millimeter, and you can see that she's developing some petechiae, but she's young. Her skin is very strong. It can definitely take this. And we have covered her skin very nicely with her thing. Okay. Now we are going to go to the forehead. Okay, come on up here.
The fun part.
I know, I'm sorry. If it's too much to take,
You're
then
fine.
tell me.
You're
I
fine.
will reduce the depth, but I would like to keep it. Okay, Gina, just come towards me. That's a good job. So it all depends on where you have your scars. If you have it on an irregularities up the skin and the pimples and stuff, then this is the good place to have it done. And we are just creating small channels. She is very well numb also, and I think that's very important. Yeah, on this side, Gina. Okay, that's okay, no worries. Turn your face this way, my dear. That's great. This actually is good for hair growth.
Ow.
I'm sorry. I know. My
The
hands.
forehead just sucks.
I know. I'm almost done. It's actually good for hair growth also. Remember we said and we talked about whichever part of the body we want to grow. You can put some here. Because it's your autologous blood it will take off on that area and promote the cells, okay? So we are actually able to do this for hair loss, okay? So hair can grow. And now we also have actually a very good vitamin for your hair, okay? So, and it's called Viviscal, and that with the hair therapy will be very, very good. Okay, you can put that on. Okay, I think we are done with this part.
My eye water.
Yeah. Okay, can you put some more of this on?
Where do you want to
Yeah, put it on. Yeah, just wherever. Keep your eye closed, my dear. I'm just going to have, just let it all go. Yeah, okay, just keep doing this. So, okay, Abby. Thank you. I'm just going to add this all over her. Okay, all right.
Alrighty, Facebook, we'll check back with
Thank
you
you.
soon. Just show you the
Sure.
results in a few days and just to see how glowing her skin's gonna be.
Yes,
Alrighty.
and Katie has agreed to go on Real Self, and
Yeah.
she's going to post pictures. And thank you, Katie. Really appreciate
Thank
you.
you.
And if Katie wants, I can actually, I'm going to inject it just under her, you know, eyebrows, so the eyebrows can grow, and so on and so forth. So I might just do that. So thank you.
Awesome.
Thank you.
Alright.